So let's wait for a while. Please complete your attendance in the moment.
Share screen na lang.
You share screen na lang.
Ask them to watch.
Yeah. Please go over with the slide. No? Sorry for the delay. Anyway, I would like to. Please come inside. Okay, I hope you bear with me. No, maybe you can come forward a little, no, because the microphone is not working. Okay. Welcome to session 2. Actually, I would like also to welcome the rest of the class no, joining us. No, it's good to see that we have increased the number no, of our students no, here on site. It's very good also to note no, that we have already come to the second session that we have. No? And fortunately, the weather is good. No, I know during the months of June and onwards, no, it's rainy season in the Philippines. Please take care also of your health. So for today, and also to our online participants, I hope you are all doing well. Hey, welcome to session 2, and the title is a landscape view no, of life and healthcare in rural settings. Last time we discussed about rural health, no, as well as rural ethics. No, why are we studying the concept no on ethics in rural healthcare? Okay, as I mentioned last time, we all know that it will be a different scenario when you are working here in the city, no, compared to those working in the rural areas. Okay, so I think I have also mentioned last time, no, that I will be giving you the full book, no, for this presentation. But to have you interest no, in really, no, getting also some of those topics. So I purposely want to discuss to provide you the copy maybe in a later time. Okay, so may I know? Please raise your hands who were not here last time, no, meaning newcomers on site. Okay, very good. Welcome. Thank you very much. No? So I would like also to ask your name, no, but anyway, I hope you have your ID, no, or your nameplate, so that I will know also, no, you personally. I would like also to acknowledge those who were here last time, no, and we had a good discussion with regards to the previous topic that we have. So if you can look on the screen, so we have healthcare ethics agenda. So for those who missed the previous lecture, no, anyway, I will be providing also the some of the summary, but definitely the book no will be provided to you. So today we will be talking about landscape view of life and healthcare in rural settings. I know some of you know are living in the rural areas, maybe away from the city. Here in the in Mandawi, no, actually this is considered already the an urban setting. No, so if you go away, no, from a distance, no, you can find already rural setting. So that's why today we will be viewing this concept, no, on the following learning objectives, so that at the end of the session, the student will be able to number one, you have to enumerate the features encountered by rural provider. Can I be allowed to take off my mask? Anyway, you're very far, no? Okay. Second, you have to define rural communities and rural demographics. It may be different in India, in Thailand, or even in the Philippines. But as I mentioned last time, no, when I went to Thailand, no, okay, I was surprised not to note that their houses, no, are also made the same, no. We call that nipa hut, no, made of bamboo, no, as well as the leaves coming from the nipa, no. So it's more or less the same. Okay. Third, differentiate the health disparities, no, or rural areas. Sorry, this is of no of rural areas versus urban areas. Again, please acknowledge no, if you have clearly seen no, the presentation. Now, identify the next objective is for you to identify the characteristics of the rural lifestyle and culture, and at the same time, enumerate the contextual features that influence healthcare ethical situations and the potential ethics sources. So, very quick, when you are working in the urban area, it will be a different scenario when you are working in rural areas. Now, why is it that we are sometimes apprehensive, when we finish our medical course? We had already passed our examination, state board examination, when we have fully graduated, earned our diploma to treat patients. Why is it that we have some challenges, when we will be assigned in rural areas? Now, these following are the features. So this could be a potential environment, encountered by rural provider. When you say rural provider, it means doctors who are working in the rural areas. First, limited healthcare services and resources. True. So compared to the city, okay, in the city you have a lot of specialists. No, in fact, earlier you have a lecturer of psychiatry. So he's certified, psychiatrist. Okay, there are also internists, pediatricians. No, unlike when you go to the rural areas, there are already limited number of healthcare services as well as providers. Second, there could be geographic barriers to healthcare services. As we mentioned, the distance. I don't know, in India, do you have islands? No, maybe more islands here in the Philippines. When you are assigned, we call that GIDA areas, geographically isolated and disadvantaged areas. Transfer, or mobilization of patient from one area to another would be very difficult. I know there are flooding in your places. There could be some landslide, there could be problem in transportation. The road network, could be very difficult also. So that's why we consider it as geographic, barriers to healthcare services. Now, the third feature could be conflicts between community values and professional guidelines. For example, when you have fever, usually in rural areas, we have this tuob, so we cover our body, with the cloth, and then we inhale something, so, or else we have smoke, so that's traditional, we call that community values. Unlike when you are treating already with patients, the doctor will give you what do you treat for fever? Is it paracetamol or is it the antipyretic? So, the same, antipyretic and paracetamol. Now, for pain, you can have mefenamic acid, and for infection, you can have your antibiotics. So there's a conflict, Others might prefer the traditional way. They could go to healers, or they can go to traditional spiritual way, of healing. Another feature encountered by the rural doctor, could be challenges to privacy and confidentiality. We keep repeating this now because when you are working in the community, you will be working probably with your previous teacher, and you will not hurt your teacher by telling the truth. Okay, when your teacher probably you have an impression of cancer, it will be difficult on your part, So you have here privacy and confidentiality. Why? You might not tell, the immediate family members, or support group, because of this reason. But you have also a dilemma, on to tell or not to tell, because you are there as a doctor and not as a student and not as a friend, of anybody in the community. And lastly, a clinician providing care could be to a neighbor, a friend, or a family member. Why is it emphasized in this way? Because there could be difficulty, on how you deal, Unlike when you are in the city, you do not know they do not know you, you do not know them. Meaning, when you treat them, you can provide advice, It's different when you are in the rural areas, because when you go out in your clinic, you will be seen as their friend, as their family member, as their relative. So there's no boundary, between a professional and a community member for the rural doctor. I know you will experience that soon, no? When you go back to your areas. Okay, so next is what is that we have a provider, meaning the doctor, not trying to deliver quality care despite being professionally isolated. So isolated meaning away from the glamour, no, of high-tech medical profession services, and of course, no, from the knowledge. But as I mentioned last time, no, whether you are in the rural areas, you can still get the updated information, no, through internet, social media, right? In fact, we are more updated, no, altogether, no, whether you are in, as long as you have signal, right? Okay, so here the quality of care, no, despite being professionally isolated, no, with limited access to peers and specialists. Okay, maybe you have friends, no, who will be successful pediatrician. When you are in the city, you can easily call, no, and they can come, no, to your clinic. Unlike when you are in the rural areas, no, of course you can call them, but can they go directly or can they go on time to your facility? The answer is no, which is the sad thing. No? There could be overlapping of professional and personal boundaries. This is the one I've mentioned. And this could be repeated many times now when we have our discussions. And lastly, community expectation and professional stress. So the community expect you to treat them even though it's already nighttime. They will knock your door. Oh, doctor, I have a problem. Oh, what's it? No? Oh, I have here a small nodule. Oh, how long has it been there? Oh, it's been 3 months. Oh, at the middle of the night, knocking your door. Unlike when you are in the city and you can always say, oh, it could be elective. No, you can come tomorrow. Because that is not emergency. No? So that's why you have community expectation, meaning you can be called anytime, no, by the community people. Unlike when you are in the professional, then you can say, oh, it's already closed. No, my clinic is already closed. No, because my clinic is from 8 in the morning to 5 in the afternoon. So that's what we meant by community expectations and the professional boundaries. So how do we define rural communities? Okay, maybe you have already an idea, no? Because of the scenario, no? The environment. But sometimes the term rural, no, can be defined or can be fined, no, or defined in many ways, depending on who is defining it, no. So usually, when you have what do you call this one, a population which is very big, no, very large, then you can say that it's an urban area. But if the population is dense, no, so that could be considered rural. So meaning population is a common way to define what is rural area, what is urban area. So that's how we are defining at the moment in terms of rurality. But there could be possibility that that definition could be based on geographic size of a community relative to population density. For example, the number of people living in a square mile. Like for example, South India, okay, the population is this big, no, but they are closely living with each other. So you can think that it's an urban area, no, with a population like say 10,000. But if you go to north of India, the population is already 30,000. However, they are not near with each other because the land area is very big. So that's also a way, no, on the definition of rurality, no, or on urban area based on geographic size. So first, it could be population. Second, it could be geographic size. And also perceptions of rural and the available resources within a particular region are relative in nature. So what could be rural definition on your side, there could be a different definition of for others. But again, let's just be agreeable, no, that we refer, no, to rural area, no, with dense with few population, no, compared to an urban area which is densely populated. So that's how we anchor our definition. Okay, moving forward, we have here rural demographics. So how is the demography in the rural setting? Thus, rural communities have a diversity of geographical regions, population dynamics, age stratification, and other feature. And for example, here in the Philippines, if you go to Manila, who has been to Manila? Yeah, very good. Okay, which is bigger, Cebu or Manila? Manila. Which has more people, Cebu or Manila? Manila. So that's how you see it, no? Based on the features. Okay. So rural communities have diverse population trends, meaning it could differ from one area to another. Okay. And also population in rural communities is described as bipolar. No, it's not a mental disorder. Huh? Bipolar meaning two poles. No, it could be those under of age, no, and those who are over 65 years old. What do you think? Why is it that there are more people who are 17 years old and below in the rural areas and the 65 years old in the rural areas compared with the urban areas? Pardon? Lifestyle? Not much. Why is it that there are more 17 to 60 years old in the city?
Work and
Oh, very good. What else? Just like you, very good. Education. Okay. So a greater population, no, or proportion of rural residents are already married, no? So they are already retiring. So that's why it's more than 65 years old and above. Below 17 because they have elementary class, no, in the rural areas. But when they reach college, they go to the city. It's just like in India, probably, no? And maybe you are from rural areas, but when you have entered medicine or your bachelor's degree, so you go to college, so you go here in the city. So that's why population in the city are more on the 17 years old and above to 65 years old. Those who are retiring, where are they living? In the city or in the rural areas? Rural. Like your lolo, lola, no, grandparents, no? So they do not like to stay here. They want to stay in the rural area because of what? Fresh air, no? So the life is very slow, no? They could hear the chirping of the birds, no? But they are good in their social media also, no? They are also fond of Netflix, right? They are also TikTokers, no? Okay. So again, as I mentioned, a greater proportion of rural residents are married, have fewer years of formal education, have lower incomes, and fewer have completed high school. Okay, so those are the demographics, no, in rural areas. Now here we move to the health disparities of rural areas versus urban areas. So may I call on the beautiful lady there? Yeah, the one in the middle. Can you please read what is on the screen? Thank you.
Higher infant and maternal morbidity rates, higher rates of chronic illness such as hypertension and cardiovascular disease, higher rates of mental illness and stress-related diseases, especially among the rural poor, lower rates of health insurance and pharmacy coverage plans.
Okay, why do you think that there is higher infant and maternal morbidity rate in rural areas? What do you think? Wait, pollution? No, I'm asking, why is it that there is higher, no, meaning more deaths among infants and mothers who are pregnant, no, or in the reproductive age in rural areas compared to urban areas? Anybody? Yes, gentlemen.
taking of proper nutrients for the
Correct. It could be. But take note that in rural areas, there are vegetables, there are fruits, no? So less preservatives. Lack of money, it could be, yes. Lack of education, no? So they cannot know how to appropriately provide, no, health services where to seek. Yes, anybody? Hospitalization. Very good. Very far. Correct. When there is potential, um, what do you call this one? Complications of pregnancy. So it would be difficult to move. So that's why deaths are there. No? Okay. How about yeah, the last one, the last part. Sir, can we have your opinion? Lower rates of health insurance and pharmacy coverage plans. What do you think? Can you speak louder? The last part, no, mentioned about in rural areas, no, there could be lower rates of health insurance and pharmacy coverage plans. Why? What do you think? Yeah, when they are in rural areas, the affordability, no, or the amount that, no, that could spend for insurance and pharmacy coverage will be lesser compared in the urban areas. No? And besides, no, accessibility to pharmacy products, no, is difficult in rural or in urban area. Rural. Very good. Thank you. Okay, let's proceed with the continuation of. Sorry. So it's what time check? It's already 5:50, right? Okay, so we have 10 minutes left. No? Don't worry. No, I have another class 4:30. No? Another class 4:30. How I wish to extend, no? But anyway, I'll just do my anyway. If we could have spill over, no, some of the slides could be discussed next time, no. But Doctor, don't worry. Usually, I'm here on time, no. So next time I'll be on time also, huh? Let's proceed, no. There are also greater expenditures, no, on prescription medications, no, associated with lack of pharmacy insurance benefits. Correct. No, we mentioned this already, and or more out-of-pocket costs. When you say out-of-pocket, no, it's the client, no, it's the patient who gets money from his pocket, no, spend it, no. Unlike when you are in the urban areas that you have insurance. So when you are buying medicines, no, it's the insurance that will be paying. No? So no more out-of-pocket. Okay. Next, problems unique to rural occupations, such as machinery accidents, skin cancer. No, usually these are for fair people. No, sun exposure in farming or outdoor labor. What do you think are other problems associated with occupations in rural areas, sir? What do you think? What are other occupations that could be
I don't know exactly the term, but those people who are in rural areas with low income.
low income?
They used to go for stone thing.
Yeah, there could be potential of there could be potential of accidents. Okay, when you are in farming, what happens in farming? Very good, pesticides. What about if there are rats in the farm? They could be bitten by the rats, snakes, right? No? So that could be potential. No? These are rural occupational hazards. Correct. Okay, so let's proceed now to the characteristic of rural lifestyle and culture. Oh, this is very exciting, no? Just like here in the Philippines. Oh, we have rice fields, we have rice paddies, no? We have a nipa hut, no? We hear the chirping of the birds. The tweeter is not the tweeter in the app, no, but the real bird who will be doing that tweeting, and the fresh air. So there are extensive distances between people and services. No, there's a wide gap, meaning less privilege, no, when you are in the rural areas. Work and recreational activities are often cyclical and seasonal in nature. Oh, in India, what do you play in field when it's summer? Cricket. What else? How about native games? Do you play kite flying? So that's usually summer. And when you say seasonal, okay, we usually here in the Philippines, when you say it's, we call, actually we do not have summer here, no, but it's a misnomer, no, because we have it dry season. So it's the time we go to the beach, no, we go outdoor, no, or we go to some places, no, for vacation or for holidays. Okay, another characteristic is prominence of high risk land-oriented occupation and activities. We mentioned this already, especially in farming, pesticides, How about for pesticides? What happened? Accidental swallowing, That could result to poisoning, or death, right? Okay. Social interactions that facilitate frequent informal face-to-face contacts. Usually in the community, you have, where do you get the what do you call this one, the gossip? It's from the neighbor, talking to the neighbor, so they are grooming the, did you know the latest of our neighbor? So that's what we meant by social interactions, A close social or kinship relationship among community members. Okay, you know your father. Oh no, you know the the father of your friend, or the aunt of your friend, so on and so forth. So this is what we meant by social, or kinship relationship. Another is that proceed. Okay. There could be informal support systems are preferred in times of need. Okay, usually when you have activity in the community, so they will be inviting, their neighbors. I don't know, is that a culture also in your place when somebody is having like birthday or marriage or wedding? So they invite usually the ones in their neighbors, unless the neighbors are bad, Also, individual and community self-reliance, but this is some negativity, because when you say self-reliance, the tendency is you are treating by your own. So you are now hesitant to visit the physician or a healthcare provider. Small town as centers of trade, correct? So what happens here? We have like we call that market day. So in a week we have market day. People will congregate, go to one place. So they put their produce, their pig, their goat, chicken, and here comes people from afar and they buy, at the very cheap price. So that's what we meant by centers of trade, Okay, churches also and schools are centers of socialization. How do you socialize in urban area? Yeah, party. What else? Go to the mall. What else? Clubs. Yeah, very good. What else? Parks. Okay. Or what's the most convenient to socialize? Where? Weekends, But yeah, malls, But you can socialize also in your cell phone, your chat group, your boyfriend, you can chat there, That's what we mean by socialization, Okay, importance of local health systems, especially hospital and long-term care facilities to the local economy. So what happened in the rural areas? You rarely find tertiary hospitals. So what is there are primary hospitals or clinics only. Sometimes none. No? Okay. There is again repeating overlapping roles of being a clinician and as a community member. So those are the characteristics of rural scenario. Now let's go to the barriers. Now what could be the reason why they do not access to healthcare? Number one, long travel distances. Very good. So you need to walk few meters, few kilometers, and then you ride motorcycle. After that, you cross a river, and then you climb another mountain. And then after the mountain, you have already the road, but it took you long time to reach your destination. Another barrier is lack of public transportation. True. I don't know in India or Thailand, what do you have in rural areas? It's also motorcycle. What is that? Is it the cheaper way or is it convenient? Okay. How about in Thailand? We call it habal-habal. Habal-habal. And then limited telephone and internet service, correct, no? Okay. Shortage of healthcare providers. Why? Because they are already going to the city, no? Limited economic resources like income and insurance because of their capacity to pay. Unlike now that we have universal healthcare, you know that the government will be paying for the insurance of all individuals. Now, this is already implemented here in the Philippines and maybe in your country also. No? So we call that universal healthcare. Challenging rules and unpredictable weather conditions. So just like what happened now, no? So weather is unpredictable. Worse if there are tsunami, no, or earthquake. No, earthquake is not predictable. No, unlike if there are rains, no, or typhoon, no, that this could be forecast. So I think it's already 5 o'clock. No, we are left with few slides. No, so what happens? We have barriers to accepting healthcare services. So we have here 2 slides, and then last few parts now would be the rural contextual features that influence healthcare ethical situations. So we have community values, again overlapping professional and personal rules, threats to confidentiality and privacy, limited access to health services. We mentioned this already. I had discussed this already earlier. Community economic limitations, clinician stress, and lastly, limited ethics resources. So here we have potential ethics resources as enumerated. Okay, I will be dealing this, no, the last few slides, no, and the activity that we have next week. So any questions so far? Don't worry, no, if I skip the discussion because it's already 6 o'clock, no, and I won't prolong, no, your agony to enjoy the weekend. And probably you will have your date, no? Any questions so far? Online participants, do we have questions or clarifications? Please turn on your camera so that we can have probably screenshot, no, for those who are joining. Yes.
Last week,
Last week.
Dr. Alfredo, I think, gave us an assignment to do reflection paper.
Yeah.
And he told me to provide an assignment space to post our work.
What is that subject?
Professionals.
Oh, that was. Okay. No. Yes, I'll listen for you. Thank you. Okay, so thank you. Let me check in our chat box. Thank you. Okay. Yeah, just keep your assignment if ever there are, no? But in the moment, no need to submit yet, no? I'll just inform Dr. Attorney Mayol, no? Because as of the moment, I'm assigned for this subject. Huh? Okay. Anyone? Any other questions, clarifications? So with that, we formally end our meeting. Thank you very much and good night, everyone. See you next week. Bye-bye. Bye, everyone.